Nightmare Disorder by Desiree Decker. Nightmare disorder is also known as dream anxiety disorder. It is a sleep disorder characterized by frequent nightmares. The nightmares, which often portray the individual in a situation that jeopardizes their life or personal safety, usually occur during the deep stages of sleep. During a nightmare, the sleeper may scream and yell out things. The victim is often awakened by these threatening, frightening dreams, and can often vividly remember their experience. Upon awakening, the sleeper is usually alert and oriented in their surroundings, but may have an increased heart rate and symptoms of anxiety. For example, sweating. They may have trouble falling back to sleep for fear they will experience another nightmare. A person experiencing nightmare disorder would have trouble going through everyday tasks. The anxiety and lack of sleep caused by the fearful dreams would hinder the individual from completing everyday jobs efficiently and correctly. Upon experiencing this, these victims should seek the immediate help of a psychiatrist. Nightmares can be caused by extreme pressure or irritation if no other mental disorder is discovered. The death of a loved one or a stressful life event can be enough to cause a nightmare, but mental conditions like post-traumatic stress disorder and other psychiatric disorders have been known to cause nightmares as well. If the individual is on medication, the nightmares may be thanks to some side effects of the drug. Amphetamines, antidepressants, and stimulants like cocaine and caffeine can cause nightmares. Blood pressure medication, levodopa, and medications for Parkinson's disease have also been known to cause nightmares. Stress reduction techniques such as yoga, meditation, and exercise may help to eliminate stress and create a more peaceful sleeping atmosphere. Diagnosis and medication can only be given to patients that report their recurring nightmares to a psychiatrist or other physician. Medications like prazosin are sometimes used to treat nightmares in people with PTSD. Therapy usually helps to deal with the frightening themes of the nightmares and alleviate the reoccurrence of the dreams. The persistent nightmares will usually improve as the patient gets older. Treatments are generally very successful. Most people don't believe that the nightmare disorder is real. This is because they just think that nightmares are a normal thing that everyone goes through at least once in their lives. They are correct, but to a certain degree. But after that, it is much more than a simple nightmare. People tend to not treat anyone differently for having this disorder, because most people don't see it as a disorder, and just see that the victim is just more tired than they normally are. There are many places for people with nightmare disorder to go for help. For somewhat minor cases, people should seek out places to work out, such as in your own home or at a gym. Also, seeking help from a psychiatrist will prove useful to help gain control of this disorder. For more intense and increased occurrences, the victim should seek help from their doctor and get their advice on what medication to take, if any is needed. The resources I used are listed here.